this particular project is a culmination of our 20 years of insurance business and the learnings that we have gathered along the way in terms of how we are able to help some of the members of our insurance program, but many of them cannot afford insurance even today. And, that's a segment of the population this particular project is all about. We had done this in a small manner prior to this large-scale project that we are now going after. I think the learning is that despite multiple avenues, Tamil Nadu has one of the best healthcare systems in the entire country. But still there is a good demand for, primary health, services, which we believe that this centers will provide. So the population, the underprivileged population of this locality can avail of free services, whether it is doctor consultations, whether it is diagnostics. I think these services are never going to be out of demand, right? I mean, there's a population which always needs this. So while we are a commercial business, we believe that, it is our responsibility to also do some service to the society in terms of, and this is an extension of that.
So how many lives do you hope to impact by way of ASK itself? And I believe you have a fair presence in South India in keeping, with your business presence as well. Could you break down these two statistics for me?
So we are opening around 32 centers to begin with in this phase 1. These are going to be spread across the country, largely concentrated in South India. There's about 20 centers in South India to begin with. 5 of them are in Tamil Nadu and 1 in Chennai. And these centers are going to be fully equipped with MBBS doctor, with a lab technician, and with pharmacy, and so on and so forth. I think the intent is to reach about 1 million lives through this program in the first phase, and then scale it further.
All right. Let's quickly talk about insurance itself. There's been reports and a bit of talk on how premiums have been on the rise, price-wise. What would you ascribe this to, really? Is it a case of the good old medical inflation continuing to catch up, hospital billing practices, product design? What's the causative agent really behind the price rise when it comes to premiums?
Well, I think it's a combination of all of these factors which you just mentioned, Jude. Actually post-COVID, we have seen a significant amount of medical inflation in India, and it's very sticky. Okay, India has the highest medical inflation globally now, and there are multiple reports, which has been published on this. 14 to 15% is the cost of medical inflation in India. So insurance premiums, obviously, cost of medical treatment is a single largest input cost for insurance, right? And if the cost of input cost is going up, then the premiums are likely to go up. So we believe that, over the last many years, the insurance premiums have been affordable. It still continues to be affordable today. But I think the fact of the matter is that because of the rising medical inflation, because of the preferences of customers to go to higher-end hospitals, to go for higher-end treatments, the cost of insurance is also likely to go up significantly.
Right. And just a word about cashless claims, something that you've actually prioritized right here at Star Health Insurance itself. With initiatives like the NHCX and the common empanelment, do you foresee a spike or an improvement in hospital insurer coordination so as to ensure, smoother claim processes, more cashless claims perhaps? How do you see this panning out across the industry?
Absolutely. I think this is the most important thing for bringing long-term, trust into this business, right? I mean, today there's a total lack of trust amongst all the stakeholders. There are 3 large stakeholders in this piece, right? It's a 3P model. There's a payer, there's a provider, and there is a patient or the policyholder. And all of them have to work in, have trust in each other. So I think better coordination with the hospitals, these initiatives like NHCX, and, there's a lot of work going on amongst the hospital associations and insurance council and all of that. I think this is all going to culminate into better customer experience, better trust, and better growth for the sector.
We're doing this chat at a time when it's almost going to be exactly 5 months since the new GST, 2.0, the reforms were brought into being, 0% GST on health insurance. How has that panned out in this space? Have you continued to see benefits being fully passed on to the insured, to policyholders, despite those challenges that existed with with input tax credits? How has that experience been?
So, Jude, this is something, it's a blessing in disguise. I would say that, the government has done something which is very, very critical. And we totally, are thankful to the government for this waiver of GST on individual health insurance, because it has led to 2 things. It has led to a significant demand growth in the sector, and more customers are coming and buying new health insurance plans.